Friends, let us study some important MCQ in immunology, which is important for microbiology students as well as medical laboratory science students. Let us begin with question number 31. One of the following statement about endotoxin is false. Options are: they are heat stable, B. Protein polysaccharide lipid complex in nature, C. Action is often enzymatic, and D. Is produced by gram-negative bacteria. Answer will be C. Action is often enzymatic. Question number 32. One of the following statement about exotoxin is false. Option A. Action is often enzymatic. B. Have a specific tissue affinity. C. Are active in very minute doses. D. Polysaccharide lipid complex in nature. Answer will be D. Question number 33. A state in which the organism persists in a small number in tissue in the presence of immune state is known as A. Energy, B. Opsonization, C. Premonition, D. Atopy. Answer will be C. Premonition. Question number 34. Active immunity is not acquired by. Options are A. Infection, B. Vaccination, C. Immunoglobulin transfer, D. Subclinical infection. Answer will be C. Immunoglobulin transfer. Question number 35. Transfer factor is A. Plasmid responsible for transfer of drug resistance. B. Extract of immunologically competent lymphocytes. C. Cryoprecipitate. D. Hyperimmune globulin. Answer will be B. Extract of immunologically competent lymphocyte. Now question 36. Hapten, option A, produces humoral responses. B. Binds to carrier to produce its effect. C. Is high molecular weight protein. D. Is the same as epitopes. Answer will be B. Answer will be B. Binds to carrier to produce its effect. Question 37. The bond that binds light chain and heavy chain in an immunoglobulin is option A. Hydrogen bond, option B. Hydroxyl bond, option C. Disulfide bond, and D. None of the above. Answer is C. Disulfide bond. Question 38. In human in human sera kappa and lambda chain occur in the ratio of A 1:1, B 1:2, C 2:1, D 1:4. Answer will be C 2:1. 39. Which of the following is true? Option A. IgM fixes complement. B. IgG does not cross placenta. C. IgA binds mast cell. D. Immunoglobulin E, IgE binds phagocytes. Answer will be A. IgM fixes complement. Question number 40. The concentration of immunoglobulin E in serum is A 0.04 mg per dl, B 0.004 mg per dl, C 0.0004 mg per dl, D 0.00004 mg per dl. Answer is D. Question number 41. Which immunoglobulin can cross placenta? Option A. Immunoglobulin G, B. Immunoglobulin A, C. IgD, D. IgE. Which immunoglobulin can cross placenta? Answer will be A. Question number 42. The immunoglobulin which with the longest serum half-life is. Question 42. The immunoglobulin with the longest serum half-life is. Option A. IgA, B. IgD, C. IgG, D. IgM. Answer will be C. The immunoglobulin with the longest serum half-life is immunoglobulin G. Question number 43. The heat level immunoglobulin is immunoglobulin D, immunoglobulin M, immunoglobulin E, immunoglobulin A. Answer will be C. Immunoglobulin E. It is heat level immunoglobulin. Question 44. The valency of immunoglobulin M is. The valency of immunoglobulin M is 1, 2, 4, 5. Answer will be D, 5. Question number 45. The immunoglobulin which is produced first by the fetus in response to infection is IgG, IgA, IgM, IgD. The answer will be IgM. Question number 46. Which of the following is true about multiple myeloma? Multiple myeloma. Which of the following is true about multiple myeloma? Option A. The antibodies produced are normal. B. It is a disease of monocyte. C. Immunoglobulins chain are either kappa or lambda chain. D. Both kappa and lambda chain are seen together. Answer will be C. Question number 47. The reaction of soluble antigen with antibody is known as option A. Agglutination, B. Precipitation, C. Flocculation, D. Complement fixation. Answer will be B. Precipitation. Question number 48. Which of the following is true about Poisson phenomenon? Option A. It is due to disproportionate antigen and antibody levels. B. There is no relation with antigen and antibody level. C. It is due to proportionate antigen and antibody level. D. None of the above. Answer will be it is due to disproportionate antigen and antibody level. Question number 49. Coombs test is option A. Antiglobulin test, B. Complement fixation test, C. Agglutination test, D. Neutralization test. Answer will be A. Agglutination test. Question number 50. The Widal test is a type of option A. Precipitation reaction, B. Agglutination reaction, C. Complement fixation reaction, D. Immunofluorescence. Answer will be B. Agglutination reaction. Question number 51. An example of complement fixation test is option A. Will-Felix reaction, B. Wassermann's reaction, C. Coombs test, D. Rose-Weiler test. Example of complement fixation test is Wassermann reaction. Question number 52. Which of the following is false about hereditary angioneurotic edema? Option A. It is due to deficiency of C1 inhibitor. B. The mediator is C2 kinin. C. It is treated by infusion of fresh plasma. D. It is always non-fatal. Answer is D. It is always non-fatal. This is false. Question number 53. Rosette formation with sheep RBC indicate functioning of option A. T cell, B. B cell, C. Neutrophil, D. Monocyte. Answer is A. T cell. Question number 54. Which cell causes phagocytosis? Option A. B cell, B. T cell, C. Macrophage, D. None of the above. Answer will be C. Macrophage. Question number 55. HLA typing is used in option A. Blood grouping, B. Assessing prognosis of disease, C. Cancer therapy, D. Cases of disputed paternity. HLA typing is used in answer will be D. Cases of disputed paternity. Question number 56. MCH restriction applies to option A. Donor selection in tissue transplantation, antigen presentation by macrophages to T cell, C. Feedback inhibition of antibody synthesis, D. Histocompatibility typing. MHC restriction applies to B. Antigen presentation by macrophage to T cell. Question number 57. Primary immune response is mediated by option A. IgA, B. IgD, C. IgG, D. IgM. Answer will be D. Immunoglobulin M. Question number 58. Monoclonal antibodies are used in option A. Immunotherapy, B. Immunological identification of cells and tissue, C. Radioimmunoimaging, D. All. Answer will be all of the above. Question number 59. Anamnestic reaction is defined as option A. Production of heterologous but related antibody in response to antigenic stimulation, B. Selective proliferation of plasma cells produce antibodies, C. Sorry friends, C. A kind of primary immunological reaction, D. None of the above. Answer will be A. Anamnestic reaction is defined as production of heterologous but related in response to antigenic stimulation. Question number 60. The function of an adjuvant in a vaccine is option A. Distribution, B. Absorption, C. Antigenicity, D. Metabolism. Answer will be C. Antigenicity. Question number 61. Cytokines A are polypeptides, B. Act on surface receptors. C. Take part in intrinsic enzymatic reaction. D. Are chemotactic. Answer will be A. Are polypeptide. Cytokines are polypeptide. Question number 62. Interleukin 1 is produced by A. T helper cells, B. B helper cell, C. Monocyte, D. None. Answer will be C. Monocyte. Interleukin 1 is produced by monocyte. Question number 63. Interleukin 1 primarily acts on A. Lymphocyte, B. Macrophages, C. Neutrophil, D. Erythrocytes. Interleukin 1 primarily acts on A. Lymphocytes. Question number 64. Cachectin is produced by option A. Neutrophil, B. Eosinophils, C. Macrophages, D. Basophils. Macrophages. Answer will be macrophages. Question number 65. Passive transfer of cell-mediated immunity is mediated by option A. Interferons, B. Lymphotoxin, C. Skin reactor factor, D. Transfer factors. Answer will be transfer factor. Passive transfer of cell-mediated immunity is mediated by transfer factor. 66. The most common immunoglobulin deficiency is of option A. IgA, B. IgD, C. IgG, D. IgM. And the answer will be A. IgA. Question number 67. Which of the following is false about Wiskott-Aldrich syndrome? Option A. Thrombocytopenia, B. Elevated IgM, C. Associated eczema, D. Vulnerability to infections. Elevated IgM. Question number 68. Kuhl's-Diel phenomenon is a type of option A. Type 1 hypersensitivity, B. Type 3 hypersensitivity, C. Type 6 hypersensitivity, and D. Type 5 hypersensitivity. Answer will be A. Type 1 hypersensitivity. . Question number 69. Anaphylaxis is mediated by option A, cytotoxic antibodies, B, chemotactic factor, C, immune complexes, D, incomplete antibodies. Anaphylaxis is mediated by answer will be B, chemotactic factor. Now question number 70. Which of the following is not a mediator of anaphylaxis? A, 5-hydroxytryptamine, B, heparin, C, platelet activating factor, D, anaphylatoxins. Answer will be B, heparin. Question number 71. Reagenic immunoglobulin is immunoglobulin G, immunoglobulin D, immunoglobulin A, immunoglobulin E. Answer will be D, immunoglobulin E is reagenic immunoglobulin. Question number 72. The Brownisch-Kushner, the PK reaction is used to demonstrate option A, presence of secretory antibodies, B, presence of Wassermann reagin, C, presence of skin sensitizing antibody, D, atopic hypersensitivity. PK reaction is used to demonstrate. Answer will be D, atopic hypersensitivity. Question number 73. Graves' disease is a option A, type 1 hypersensitivity reaction, B, type 2 hypersensitivity reaction, C, type 3 hypersensitivity reaction, D, type 4 hypersensitivity reaction. Graves' disease is type 2 hypersensitivity reaction. 74. The type of immunologic response in post-streptococcal glomerulonephritis is option A, type 1, B, type 2, C, type 3, D, type 4. The type of immunologic response in post-streptococcal glomerulonephritis is answer is C, type 3. Question number 75. The cause of immunity is option A, enhanced helper T cell function, B, enhanced suppressor T cell function, C, decreased immunoglobulin synthesis, D, all of the above. Enhanced helper T cell function. 76. The graph taken from a cadaver is The graft taken from a cadaver is option A, autograft, B, isograft, C, allograft, D, xenograft. The graft taken from a cadaver is allograft. 77. Graft versus host reaction is caused by option A, B lymphocyte, B T lymphocyte, C macrophages, D complement. Answer will be B T lymphocyte. Graft versus host reaction is caused by T lymphocyte. Question number 78. Besides vaccine against tuberculosis, BCG is also used in. Besides vaccine against tuberculosis, BCG is also used in option A, acute leukemia, B, remission of malignant melanoma, C, intradermal recurrence of breast cancer, D, all of the above. Answer will be D, all of the above. 79. The most common complication following blood transfusion are option A, allergic reaction, B, volume overload, C, infection, D, hemolysis. Infections. Answer will be C, infection. The most common complication following blood transfusion are infections. And the last question. Rh antibodies are detected by option A, using a colloid medium such as 20% bovine serum albumin, B, using red cell treated with enzymes such as trypsin, C, indirect Coombs test, D, all of the above. The answer will be D, all of the above. Friends, thank you for watching and please subscribe my channel.